Welcome to this week's Interactive Virtual Experience, or IVX. This is the fifth session in a series of weekly peer-to-peer discussions on practicing during the COVID-19 pandemic. We are honored to have you here with us today. We're here to share best practices from one OD to another as we navigate the uncertainty around us. I'm really looking forward to our discussion this week because the interaction during our previous events has been really fantastic. At this point, I've had to bribe my kids with video game time during these sessions, and I am subsequently learning the new Fortnite dances that they're trying to teach me. So I will have an added skill set thanks to this pandemic. My name is Dr. Carissa Lee, and I am the head of professional affairs at Johnson & Johnson Vision. Just like you, we have had to pivot our business in the face of this crisis. Our goal is to always be here to support you and your patients. You can take comfort in all that AccuView is doing to help. Our efforts are focused on helping you continue patient care, prioritizing safety at every level, and supporting your cash flow. Please feel free to reach out to your local sales rep if you'd like more information on this. Before we start, I want to go through a little bit of housekeeping. We want to answer as many of your questions as we can. So throughout the discussion, you can submit questions. Just click on the Q&A icon on the bottom bar and submit your thoughts. We'll also answer as many questions as we can, and if we can't get to all of them, we'll certainly collect them and try to get them answered through future communications or through your reps. I was happy to see lots of chat traffic last week, so feel free to use the chat module to share comments with other attendees. Just make sure that you select all panelists and attendees to share your thoughts with everyone. I can't believe that we've been working from home for almost 2 months now, and so I am excited to hear tips from today's speaker about how we can get back to a new normal. So let's get started. I'd like to now introduce you to Dr. Stephen Cohen. Dr. Cohen is a distinguished international speaker, clinician, and consultant. He owns a successful private practice in Scottsdale, Arizona, where he's won the Spectrum Award for the #1 eye doctor 5 years in a row. Dr. Cohen has been a leader in our community for a long time. He was actually one of the founding faculty members of the Johnson & Johnson Vision Institute. So we're grateful to have him with us today. Please welcome Dr. Stephen Cohen.
Hi, Dr. Lee. How are you?
Good, thank you.
Good. So you had your epiphany, you're learning all these new dance moves. For me, I learned something really interesting over the last few weeks. I learned that lifting the remote control up and down and walking from my couch to the refrigerator does not constitute exercise. Well, so welcome everyone. This has been a remarkable period of time for all of us. And many of us have been in practice. My practice has remained open throughout. In the early stages, it was primarily urgent and emergent care and has gradually expanded from there. But I'd like to start out with a poll question to get an idea of where you are in your practice to see who's open or who's preparing to be open. So if we can have the first poll question, that would be great. So have you reopened your practice yet? Are you back full time? Are you somewhat back, or are you still at home waiting to open up? So we'll give just a moment for the responses. So still about 2/3 of you have yet to reopen your practices. So that poses, of course, a big problem because you've been struggling to get through this very difficult time, but it also leaves you with an opportunity to be able to prepare moving forward. So when you're able to start up again, you have plans in place to do so. You know, a lot of times comedians will get on stage and they'll give an example like, earlier today, I was walking somewhere and they'll tell something and you think, gee, if that didn't happen then today, then would they have no routine to talk about? Well, I have an example like that from today that actually did happen. And that is at lunchtime today, I went to see my dentist and I was really interested since dentistry is one of those areas that we're really concerned about exposure and flying aerosols and whatnot. And their office, they actually had one of their dental assistants working at the front door. We had to wear masks going in. They were mask gloved and gowned and gave us an iPad that they cleaned off. They immediately went and disinfected the door handle after someone came in. So there were so many steps that they were taking. I got to talk to the dentist about it. So, and I spoke to him, I said, well, what I see as one of the challenges you face is that you're seeing fewer patients a day than you usually do. And now you have one of your back office dental techs working at the front, merely trying to help the traffic and disinfection at the front office. And he said, exactly. Well, there's where the challenge that we face is in what we're going to do in this environment to be able to keep our practices not only open and safe for our patients, but also viable. So if we can close the poll question now. So the critical point is how you educate your patients about the steps you're taking to create a safe environment will be as important as the steps you're actually taking. This is one of those examples in which we talk about perception as reality. This is probably the quintessential example of that. What patients perceive you doing is going to be how they're going to judge you, not just in what they see you do or what you tell them that they do. So it's so critical to be able to educate patients about what's happening. And the problem with this is we're in uncharted territory. Nobody knows what to do. I remember speaking to my sister who works for the city of Phoenix, and I was telling her some of the challenges that we were facing and coming up with a plan. And she said, well, there have to be places that you can go to get these answers. I said, no, there are places I can go to get the questions. I can find out what issues we need to look at, but there are no answers. We're making it up as we go along. Down the road, we'll have a standard of care. Hopefully we won't need it, but there will be a standard of care that'll be established. But right now, we're really just flying through it, trying to figure out what makes sense and being responsive to the situation. But having said that, there are still good resources that are out there. Johnson & Johnson, through these Zoom meetings and through other things on the website, have become a very good resource, I know for me and for many of us, to be able to get suggestions and have links to other resources. And also the AOA came out with a terrific one. It's the Optometry Practice Reactivation Preparedness Guide. And I believe there's a link to it that's going to be, you'll be able to see. This has lots of there's the link, lots of suggestions. It has lots of links to the CDC and to other resources, including where you can get PPP. So I think it's a valuable one to go through. I believe it's about 7 pages long. Speaking of the CDC, today they came out with their guidelines recommending that masks should be worn by staff and doctors as well. Still haven't come out with anything definitive about whether we should be requiring patients to wear masks when they come in the office. And that'll be an individual decision that you'll be making. So with that, I'd like to turn over to Dr. Lee and see if we have any questions at the outset.
Yeah, we'll do one question here, and then I think a few more questions after you go through the next section. But one of the questions is around, I think as you were talking about PPE, what are you doing in your office? And are you doing goggles, brush shields for the slit lamp, et cetera? What are you doing today?
We have a shield that we have on the slit lamp, and we're all wearing masks. At this point, not using goggles because the shield has been enough of a block for that. But that's an issue that we're all going to struggle with as to what is enough. At this point, what we have is a shield and the use of a mask.
Great. So I think we'll move to the next slide. Perfect.
Okay. So for the next slide, which is talking about what the challenge that we face and also what the opportunity is. So I'd like to start out with a second poll question, if we can put that up. So the biggest opportunity for growth in my practice right now is, and then you can look at these contact lenses, eyeglasses, or more traditional eye care, dry eye treatment, myopia management, chronic care. And chronic care would be things like, taking care of monitoring patients with macular degeneration, treating patients with glaucoma, dry eye, ongoing treatment for patients with dry eyes, and also vision therapy. So if we can come up with what some of the things that you feel are opportunities for growth at this point. So we look at it, it's spread across the board, contact lenses opportunities being one. And I think that's certainly a viable one. The key is with this is that we have more to prepare for than we realize. And there are no clear guidelines, as I mentioned before. So when we look at the opportunity that we have, is first to look at the overall policies and procedures in your office. Do you have an office manual? So considering that about 2/3 of the people attending have not yet opened up, think about how have you used the last several weeks? How are you using the time today and in the coming days? So one of the things to look at is your procedures and policies in your office and see how maybe you can update some of those. So use this time off to be able to enhance your practice. It might be purging through files. It may be cleaning, but there are a lot of things that can be done during this downtime that'll help you be prepared for when you return. In addition to the fact that with so many good ideas that are out there, one of the things we usually lack of time to be able to do them and to implement them. This is one of those hidden gifts that we're getting out of it, and that we do have time to look into these things. So, things like policy procedures of educating patients about extension of contact lens and medication expiration dates. What are you doing? How have you handled that in your office when patients are calling? How are you letting your patients know that even though they may be due for their return for their annual supply of contact lenses, that you'll extend that? Plus the fact that most of the companies that now and the distributors are doing free shipping to patients so that you can extend that prescription and be able to supply them with a 3-month or 6-month supply, whatever the case may be. The same thing with medications. Patients that may otherwise be required to return to your office for their refill, say for glaucoma medications, that you let them know that you're extending out those prescriptions for their benefit as well as for your office. When you look at it, is one of the things to look at is your website. Have you made updates yet on your website in general, but specifically about COVID-19 and specifically about what steps you're taking in your office? If you go to my website, and maybe they can add this, it's www.drmyeyes, all 3 words spelled out, .net. We put a pop-up on the homepage that tells about COVID-19, about our response to it, and also provides information about the telemedicine program that we've added into our office, so that patients can see that immediately and can get more information about it. So you don't want it hidden somewhere in one of the buttons on your website, but it should at this point be front and center. And we'll look forward to the day when that can be put more back into the somewhere into the rear. But right now it's front and center. So then, speaking of adding services, how many of you've looked at things like a telemedicine program? There's a lot of controversy out there because a lot of our colleagues are concerned about whether this is going to be leading to refractions and eye exams that are done this way. But the key is we need to shape the agenda by getting out in front of this issue. So how would we do that? It would be to get involved, whether it's one of the commercial programs that are available, that are telemedicine programs. You talk about a profession that has fared well during this crisis. It's certainly companies that offer this. Telemedicine has been around for a long time, but now it's become critical. So even if you add telemedicine just for emergency care, it could be for patients that are unable to come to your office or unwilling to leave home to come to your office, there may be an opportunity to be able to offer that. Now would be the time to establish that relationship, build that platform, and make it available to your patients. There could be extended use of telemedicine. There may be opportunities to be able to do contact lens checks, because some of the program platforms allow you to check visual acuity. And there may be an opportunity to triage patients because we're trying to decrease the congestion in our offices. So look for those opportunities, but telemedicine is something that we should look at. When you do, one of the things that's changed, Medicare and a lot of the insurance carriers have changed their policies about, first with HIPAA, what they're allowing you to do, because now you can do some telemedicine using your iPhone and some other things that may not be HIPAA compliant. And there are the G codes that are available that you can actually allow for telemedicine billing. What we've done in our office is we've started out by making it a cash service until we get our feet wet and comfortable with it, where we've been able to have patients schedule the encounter. We're able to then hit a button, we connect with them, and where possible, we've been able to speak with them, diagnose, and then provide treatment for patients from the comfort and safety of their own homes. But there are other specialty services that you might consider for your office, and now's the time to investigate those things and come up with a plan of how you want to incorporate that. Myopia management, I think, is a huge opportunity for our profession. So at a time when we're feeling threatened from so many different directions of the bread and butter of what we do, and in the poll question, the biggest one that was listed was eyeglasses, which speak to the bread and butter of what optometry has always been. But myopia management is an incredible opportunity when it's estimated that 50% of the world's population is going to be nearsighted by 2050. We can get out ahead of that, and we can wind up being proactive. And I would say prevention is the best treatment, and there's an opportunity there. Same thing when you're looking at dry eyes, that are you a dry eye center of excellence, so to speak? Do you have that opportunity to add that? Many colleagues, because I've lectured often about dry eyes, and many colleagues say it's not a very profitable part of the practice. But just think about your contact lens practice. If you resolve an underlying dry eye problem, you're probably going to minimize the number of contact lens dropouts you have in your practice. So don't just look at it as straight what the service is, but also what it provides for the other things in your office that you're known for and that you continue to do. If you have a digital refracting system in your exam room, I'm not talking about now telemedicine, I'm talking about in lieu of the standard phoropter that we see, like it's on the slide there. If you have that, then capitalize on that by telling patients that because you have this advanced diagnostic testing, you're able to test the patient from several feet away on an iPad, rather than standing next to him for several minutes, spinning the dials within that social distance. So if you have that, educate patients about that. If you don't have it, maybe now's the time to consider adding that in your practice. I know it's difficult at a time when we're all trying to manage cash flow, but there could be a long-term benefit there. When you look at it in terms of your practice, how many of you have put together guidelines for what you're going to do through this? In my office, we started several weeks ago with a blank piece of paper, and I think there are very few things that are as intimidating as a blank piece of paper, because you have no idea where to go with it. And what we did is just first got ourselves comfortable with it being a blank sheet, and saw it as an opportunity that we can now create the different steps that will help to make our office a safe feeling place for our patients. So we put together these guidelines. Right now it's a 4-page outline, and I believe I'll be posting my email address. If anyone wants a copy of it, I'd be happy to try to forward that on to you. Not because it's the end all, but because it's an option, because it may help to propose, like I mentioned about the conversation with my sister, the questions we need to ask. So my recommendations in putting together is, 1, be comfortable with a blank sheet of paper, and 2, there's an old saying, begin, the rest is easy. Find a place to start. Involve your staff, because you're going to need their buy-in. Any plan you set up is only going to be as good as the weakest link. And if you do it by edict, it's possible you may not get the buy-in from your staff that you need. And they're the ones that patients going to see first and last. And it's critical that they're involved. Plus, they'll have a lot of good ideas. It'll give the opportunity for them to give feedback, be creative, be empowered, and then also to be able to tell you what opportunities it provides, as well as what challenges it may pose, something you come up with. Whether they're wearing masks, and then how do they answer the phone? Whether you get a plexiglass shield at the front desk if you don't already have some sort of a barrier. So start with that blank sheet of paper, and the next thing to do is walk outside the front door of your office and turn around. Look at the front door and start there. When you look at the front door, one of the advantages we've had here in Arizona up until recently is we've had magnificent weather. So we've been able to keep our front door open up until the last 2 weeks. But then we looked at it and said, what do we do next? Do we follow patients outside with disinfectant and clean off the door handle? Do we leave disinfectant towels outside for them to use? Until one of our staff said, yeah, the problem is a lot of people are stealing those. So we looked at it and said, that might be it. So what we've come up with so far, and again, you have to be flexible in this, is we have a sign on the door, and we have a paper towel dispenser on a table, on a desk right outside the front door, and invite patients to take a paper towel, use it to open the door, and then discard it in the garbage that's right inside the door. So that's our plan right now, but we're open to change that as other people come up with ideas and as things evolve. But so far, it's been well received. Walk through every part of your office and do the same thing in each area. Have your staff do that. If you're concerned that familiarity could breed some myopia in this case, maybe ask a family member or a friend to walk into your office and identify where the areas of concern might be, so that you can see what things you have to look at. We don't think about the fact that we don't often look, as practitioners particularly, are the magazines on the table? Well, guess what? We can't have magazines out anymore. What about brochures? We shouldn't have brochures out for patients' take. We may have to have them and hand them to a patient on a pertinent topic. We have to change the thinking that way. What are we doing with our restrooms? What are we doing in the exam room? So look at all of these different things and park your ego outside and be willing to listen to all those around you, how you can set up this plan. And keep in mind that it is a lot easier to come up with a plan in advance and discard it out of lack of need than it is to be faced with a crisis and then try to scramble for a solution. So by being proactive, you'll be prepared and hopefully you won't need them. When it comes to your exam room, do you decide that you're going to clean and disinfect the exam room in front of the patient, or you're going to do it in between patients? So in our case, we're using an operating room grade disinfecting solution that is so caustic, we have to use gloves just to be able to clean with it. And we're using it several times a day. So we didn't want to clean while the patient's in there for fear of it being irritating. So we had to find a way to tell them what we're doing. So on the door of the exam room, hung on a handle, was that one side said this room requires disinfection for your safety, and then we're able to flip it and say this room has been disinfected for your safety. So when I leave the exam room, I turn it around that it needs to be cleaned. Staff member then goes in and does that, turns around so the patient walking in can see that that sign is up there. In addition, we took like a checklist, it actually is a checklist, and taped it onto one of the cabinets in the exam room that shows that these are all the steps we took to help disinfect the room before you came in, and we'll be doing it again after you leave, so that patients are informed of what's happening without us having to do it physically in front of them. Other issues that you can look at: what do you do about patients who may be running late? Now we're trying to space patients more, but you have to have a plan in place. Right now, if they call and they're stuck in traffic, which one day will be a thing that we'll be dealing with again, what are you going to do? Do you tell them, come in, we'll work you in between patients? Do you have to reschedule them? How do you let patients know in advance that being on time is critical for their safety as well as the safety of other people in your office? What are you going to do about your hours? Many of our patients now are using all their paid time off so that our office hours may coincide with theirs. And it's possible, the way we're telling our staff, all hands on deck, don't take vacations now. We need our staff here as we start to ramp up. And when we ramp up, what are you going to do to make it available if your patients are faced with the same thing in their place of work? So do you expand your hours? Do you have evening hours and weekend hours available? Do you split your staff both to be able to accommodate those hours and also to be able to separate them on a precautionary basis, so that if, for example, you get a call on a Tuesday from a patient you saw the prior Thursday and they said, I tested positive for COVID-19, what are you going to do about that? What's your legal obligation in informing those patients that may have been in the office that day? And what about your staff? Well, if you have a split staff, then maybe only half the staff ran the risk of being exposed to it, and maybe the other staff that wasn't in that day of those hours may be safer. So they're not necessarily things that you're going to do, but things that you need to consider what to do about. So to repeat, I would say walk through the office and look at it with fresh set of eyes and envision everything that a patient may encounter. And then better to have a plan in place and not have to use it than to be faced with a problem and not be prepared for it. Now, the last thing before we go to some questions, the last thing is on the very end of our outline, a challenge that I offer to our office staff that says, how do we stay viable in an environment where costs to create and maintain a safe environment increase while patient scheduling frequency may decrease? So now our overhead may be going up and our top line income may be challenged. So that's where you want to get everyone's input as well, to see not only how do we create a safe environment, but how do we stay viable since we're running a business to keep it working and thriving. So with that, if there are any questions, I'll be happy, Dr. Lee, to try to answer any.
Yeah, I have to say we have a ton of questions here. So what I would just tell the group again is to make sure that if you have a question, we've got over 400 people on here. So if you have a question, make sure that you put all panelists and attendees, and to throw it out to the chat group also. I just don't think we're going to have time to answer them all from the Q&A box. So feel free to throw it into the chat box. I know there's been a lot of chatter there. Just make sure you hit all panelists and attendees so everybody can see your questions. So I'm going to group them together because we've got buckets. I am really excited to see that people are interested in contact lenses during this time. There are a few questions around that. One is around new contact lens patients. So how can we safely train them? It's hard for them just to watch a video And then are you doing any new contact lens fits, RGP, sclerals? What are the protective measures that you're doing when you're doing the fittings?
Yeah, great question. Well, one thing you can do is potentially set up virtual meetings. It might be through a telemedicine platform or something else to be able to do the training remotely. If you have a contact lens training room, you could get a divider of plexiglass or something that could create a physical but visible barrier there. What we've tried to do with new fits was just to try to schedule them a little bit later. It poses a challenge for us being open now because now's the time when a lot of people are home and have the time, whether it's kids home from school or adults who may be working from home where their time may be more available to get into contact lenses. So we want to be able to accommodate that, but at the same time, we're looking at it of, can we schedule those patients a little bit further out? So what we've been trying to do primarily is to delay it, but there could be, videos can still work and could be an option. Then it could be followed up with a video chat to be able to go over that. And then third would be to do it in your office, whether it be wearing barriers or to have a physical barrier between yourself and the patient. At least it's a starting point.
Great, and we also have resources on J&J Vision Pro, like our Lens Assist, which is a virtual chat that they can utilize too, so along with videos. But I understand sometimes watching a video is different than training in person. Another bunch of questions around NCT and tonometry. Have you switched to, or I'll ask you, what measuring device do you use for pressures?
Yeah, we do applanation tonometry, and I can appreciate with NCT where there might be a concern about that because of any aerosol potential. With applanation tonometry, we're not as concerned. Again, we do have that barrier on the slit lamp, so it has not been an issue. And of course, then going through the disinfection process as soon as the patient leaves the exam room.
Similar question about Humphrey visual fields too. Are you still doing visual fields on your patients?
Yes, we haven't had a lot of need to do it where it's been a little bit more urgent to do that. Some we've been able to schedule out, partially because of just looking to reduce the number of patients in the office, also partially to not be able to overstress the staff as we're trying to schedule more time in between patients. But I don't see a reason we can't do visual fields testing. Patients perhaps are wearing a mask, we're wearing a mask, we can stay a distance away from them. So I think that visual fields can still be a part of our practice even during this period.
And when some questions about, I guess, just how you are doing that social distancing. So when you say you're using shields, are you referring to breast shields on the slit lamp or phoropter, or a face shield along with your mask?
We have not used a face shield, although that, again, as I said, a work in progress. So each of you will make those decisions based upon your comfort level and what you might be facing. And we have a little bit of an advantage here in Arizona. We have not been hit as hard. If you're in New Jersey, New York, and some of the other places, it's a whole different situation that you're facing than what we are. But we have not used face shields. We are using the breast shield for that. For our phoropter, we're not, but again, as I mentioned before, using a digital refracting system where I'm able to sit across the room from a patient. So I'm a good 5, 6, 7 feet away from them, controlling that from my iPad. So I'm not close to the patient for an extended period of time. So if you don't have that, then you might consider some sort of additional shielding while you're doing your refraction.
And then in a similar vein, do you have clear plexiglass in front of your reception desks in addition to the social distancing?
Yeah, this was an interesting problem that we faced because I had set up my office specifically because I wanted to feel more like people coming into a family room than into a clinical medical practice. So we didn't have the traditional glass separation there. So we wanted it more open, and we don't have the chairs in there. We have love seats and couches in our front office. So that's changed things a lot because now a lot of people walk in, they won't sit down. They're just standing. We did order, and we do have a desk standing plexiglass shield with a little slot on the bottom that could slide in, whether it's their insurance information, whether it's a chart, a credit card, whatever it is you may need to do. So there is that opening. So we did add that, and we made markings on the ground of 6-foot distances at various places in by the front desk from the person who's behind the desk, so that patients can see where 6 feet is if they're comfortable doing that. And we have it around the front office. We even have it go partially down a hallway, so that if we happen to have a little more congestion in the office and patients don't want to wait outside, it gives that opportunity for them to know where 6 feet is and to be distancing, just like we're seeing in a lot of the retail operations. So, you know, at first we didn't have that. We were keeping that distance, but so much of it is perception. Even when it comes to masks, when people walk in the front door, is the old saying, you can never get a second chance to make a first impression. They're going to get a first glance of what it is that you're doing and often make a judgment of your entire office based upon that. So I think that investing, if you have someone that's good and can fabricate a plexiglass shield, is a good added barrier. And if not, there are some that are available online that you can get.
Great. And a few questions about what telemedicine platform you are using.
Okay, I'm using iCare Live. There is a fee that we pay, a monthly fee, but I looked at it as an investment long-term, not just short-term. I can tell you from my experience, a practitioner, iCare Live has been a terrific organization to work with. They have daily training sessions, then they have personal training where they're doing one-on-one with their office staff, and they give a number of resources, including links that you can then put on your on Facebook, you can put onto your website to be able to link to it. It's been very impressive in terms of the way they put it together. And they have also, they're constantly making changes. So every time they have an enhancement, they're letting us know. And I got so quickly involved that they asked me to be a panelist in a national meeting that they had with several hundred practitioners who've expressed an interest to talk about my experience with it. So you might want to go to icarelive.com and take a look and maybe schedule one of their meetings to get a feel for what you think, because going forward, it's an opportunity to reduce congestion in your office, potentially triage patients, and also perhaps to provide some after-hour emergency care without them having to leave home, without you having to drive over to your office. Patients are really happy with that and often are willing to pay rather than just submit it to insurance, and they can submit it afterwards. If they know that they can get you online, they can do it quickly, and they don't have to leave the comfort of their home.
Yeah, so good points. Again, a few more questions about the safety aspect. So do you use a wellness form, or are you taking temperatures or providing masks to your patients when they come in?
At this point, masks out here have really sort of fallen in the last couple of weeks being an issue. But I'll give you an example of somewhere where we dropped the ball. I was telling everyone in the office about wearing masks. But one of our opticians was dealing with a patient, and the patient didn't have a mask, and said, you know, it doesn't matter to me. If you don't have to have a mask on, you know, we're not that close to each other, and was okay about it. But another patient walked into the office, saw him working with a patient without a mask, and actually took pictures of it, and she complained to me about it. And this was after I said, you know, you need to wear a mask. So that allowed us to go from it being, you know, we need to be aware of it, that in all public areas of the office, every member of the staff must have their mask on. If you're not wearing it full time, at least as someone walks through the front door, the mask should be lifted from below the chin to cover their nose and mouth, to have that as a minimum. Now, in the privacy of an exam room, what you decide to do, if a patient's not wearing a mask, if you're comfortable, that's something that you can discuss it. But otherwise, we're having them wear the masks. We're not providing masks for patients yet because we have not made it a requirement, although my dentist today did ask that I wear a face covering going into my office. But it's something that very quickly could become a requirement. And if so, we'll have the PPE available to furnish patients who don't have a mask or a scarf or bandana or something that they can use.
Yeah, and just to clarify, when you say mask, are you wearing N95 masks, surgical mask, cloth masks? What are you guys doing?
I've been wearing an N95 mask that I've been doing, but you know, it's some sort of a shield. And I know the jury's still out about it. Its efficacy, its value. You know, Fauci some time ago said it would only be good if you have it to stop from spreading it. Then he said masks aren't needed. Now they're saying it is a good idea. Better to err on the side of caution, however you do that. But you know, the masks, unless you're using that industrial grade, may not be giving complete protection, but they certainly send out the impression of protection and do provide some barrier.
Yep, and I would just say I see a few chat questions. I was at Ace Hardware and saw N95 masks at Ace. So I think that the PPE, although it may be limited in some areas, if you keep checking, I think they'll probably have
Yeah, and
shipments
Dr.
in.
Lee, I believe on those guidelines from the AOA, I think it's on the last page of it, they talk about the fact that with their relationships through the AOA, that they have an extensive supply through one of their partners for PPE. So I think that they make sure that there's an availability that you can get through that link. So I think it's on the last page of those guidelines from the AOA.
Great. So one last question before we have to move on. And I know there's still a lot out here. So again, click all panelists and attendees and you might get some answers from your colleagues online. How are you disinfecting frames that you show patients as you go? And are you limiting the amount of frames that you're showing your patients?
Well, and even there, you're only as good as the weakest link of the plan. We had apparently one patient, the same patient that witnessed one of our staff not wearing a mask, was trying on frames, and we have clear signs that say, if you try on a frame, we give them a tray and say, put the frame in the tray, we disinfect the tray, and we disinfect the frames. But one patient was seen putting a frame back on the board. So we have to be super careful to make sure our instructions are clear and to make sure that they're followed. So we provide each patient with a tray, and on the bottom of the tray is a laminate sheet that says, when you finish looking at a frame, put the frame into this tray. We will be happy to clean and disinfect the frame after you do, because we don't want patients not feeling like they can't browse if they want to. Of course, other times we're dealing with direct encounters between an optician and the patient, so that makes it a little bit easier. Those frames are segregated, and then they're cleaned with a disinfecting solution afterwards. But there's been some industry concern about how some of the disinfecting solutions might degrade some of the materials. And from what I understand, what's been found to be looked at as a decent disinfectant is UVC. We ordered, but have not gotten yet because of all the delays in shipping, a box that looks like a cooler that you would take on a picnic that is a UVC unit that we can put the frames in, and it is effective in killing the virus. So when we're looking at some frame materials, we were concerned about the sensitivity of the frames to alcohol and other disinfecting solutions. We'll have that available to use as well. It might be something worth looking into. In addition, telling people that there are UVC boxes they can put their iPhone in as well, that'll disinfect that. That's available as a recommendation.
Great. So in the interest of time, I know we have a lot of questions we did not get to, but let's move on to the next section.
Okay. Well, this part I think is as important as anything that we do, because it's critical of how we inform our patients and the public of what we're doing. So what I'd like to do is, if we can put up our third poll question to get a sense from everyone. These are either actions you're taking or that you're planning on taking in your office. About some people are asking patients to wait in the car and then they're texting them. The requirement of masks, as was talked about before, telemedicine. What are you doing in front of the patient? I know when it comes to cleaning hands, I'm washing my hands 2 or 3 times in front of the patient during each exam. Digital refracting, we talked a little bit about contact lens training. So if you can put what some of the things you're doing, you can pick multiples of these or that you plan on doing. So do we have some responses up yet? Now, so one of the biggest thing is almost 100% are requiring or providing masks to all patients and staff. I think that for at least the immediate future, that's going to be the safest thing to do. Err on the side of caution. And the other one that is about cleaning hands, eyeglasses, and surfaces. So I think that in the exam room, you may have the opportunity to be able to educate patients, depending upon the type of solution you're using, as I mentioned, about what you've done, but it's critical that they know about it. So what says on the slide, it not only matters what you do, but what your patients see you do. That's true. But I look at it, it matters what they think you're doing, what they're aware you're doing, and what they perceive you're doing. That's not to say of not being honest about it. It means that you need to educate them. You need for them to know, so that understand that we're not just in the eye care business, we're in the perception business. And it's up until now, the perception has been that we're qualified and talented practitioners, that we provide terrific services. Now we have a whole different area that we need to add that is much more front and center than it ever was before, and that is the perception of safety in our offices. If patients walk in and see the efforts that we're doing and see and we're informing of what we're doing, they're more likely to feel comfortable coming, allow their family members to come, and inform other people that that's the case. And whatever you may think is the most important thing in your office may not be the thing on their agenda. Again, masks being what the majority of people wrote, it wasn't that long ago that mask was sort of, well, it might be a good idea, it might not. But we may look at it and say, washing your hands, not touching your face, cleaning surfaces, and if you're not feeling well, stay at home are the critical things. Someone else may look at it and say, no, mask is the most important thing you can do. 6 feet social distancing is the most important thing you do. And we can only respond to what the patient's perception is about that. So remember, it's all about perception. That is the things that patients can see you doing and the things that they can find out that you've done is important. So what you need to find is what are the resources you can use to communicate and educate your patients. So a blast email. And I know that everyone on this call got about 50,000 emails from every company they've ever dealt with about COVID-19 and about what they're doing. In the first week that this crisis started, everyone was inundated with those, to the point that if people saw in the heading that it was COVID-19, probably many people just deleted it and weren't bothering to read after a while. So you need to make sure that whatever your heading is on, whether it's a Facebook post, Instagram, or whether it's on an email that you may send or a text, that something catches their attention, that this is important information and newsworthy to them and important to them, and not just a general update that they've heard from every source that they have. So if you send out a blast email, tell them step by step what it is you've done in your office to make it a safe environment, what things you're doing. Invite their feedback to be able to come up with ideas. Have written explanations about the steps you're taking that could be sent to patients, that can be handed out to them, that could be posted in the office for them to be able to read, because it's so critical that they're aware of that. If you're on social media, use that as an educational forum. So what we've done is we tried to limit the posts that we've done. We did one early on that talked about emergency care. And although it wound up being something that let people know that we're available for emergency care, it also wound up being a community service. So what we put on there is that we want to keep patients out of emergency rooms and urgent care centers so those providers can concentrate on people who may be sick with the virus. And we want to keep you as the patient out of those environments where you might be exposed to the virus. So we're available for emergency care, and we let them know we will see you regardless of your insurance and your ability to pay. So it wound up being a community service that, instead of being looked at as promoting a service in our practice, we wound up getting upwards of about 30 shares from people who wound up putting it in their network, and they wound up getting thousands of views because it was looked at as a service we were offering to the community to help keep them safe. So if you have that available, and we were also able to let them know about a telemedicine program. Contact lens use during this crisis. Early on, the recommendation was that maybe patients should avoid using contacts. And then it became a recommendation that you should have patients wash their hands before insertion and after insertion. And now the CDC has changed and felt that contact lens use during this crisis is safe and that it's not a high risk for patients. But you can put that in there. We posted something about the increased use of digital devices and computers. So we addressed it and said, this is important information. Please share it with your, if your parents, with your children, if your grandparents, if you know people have children, or if you're now working from home, about what the visual impact could be from this prolonged use of digital devices, whether it be blue light, eye strain, kids who spend hours a day in school, most of it looking across the room, but occasionally looking down, are now doing all of their schoolwork from 2 feet away. And thank goodness we have those resources available so that kids can still maintain their education during this crisis, but it doesn't come without a price tag. And that price tag is the eye strain. So we were able to put on their recommendations for things they can do to breaks in 2020 and all these different recommendations of how they can do that. And one of the ways that we saw what might fit into a little bit more urgent as far as an eye exam might be a patient that has a desktop computer at work, and we gave them computer glasses for 3 feet away, and now they're at home using a laptop and it's 18 inches away, and now they can't see and they're experiencing eye strain. So there's the opportunity for them for us to recalculate their prescription to accommodate what their new needs are. We've also had things about, we posted many weeks ago, I posted about vitamin D as being a supplement to consider and the importance of spending time outdoors. And usually 30 minutes outdoors is enough to produce vitamin D that's protective. It helps to bolster our immune system and also helps specifically against respiratory inflammation. And then just the other day, there was a study that came out that talked about how vitamin D could be critical to help fight against the cytokine storm, which may be more the culprit in causing lung damage than the virus itself. And here we had already sent out a post about it weeks before. So I think that there's, you can look at ways that as long as you're posting things and sharing things through the patient that are in their interest, that are educational, they'll see the value in it, not just to be giving them updates in general about what's happening. The next thing in there is the emotional impact this crisis is having on people. You've all experienced it in your dealings with yourselves, your family members, the people you're talking to. I can tell you in practice, you're going to deal with it all day long. I go home at the end of the day, and even though I'm seeing fewer patients a day than I did before the crisis hit, I'm going home more mentally tired now than I did when I was seeing 20 to 25 patients a day. And part of it is fielding the constant questions, is staying on top of it to know that we're doing everything possible in our office to create a safe environment. It's mentally fatiguing. And to deal with the amount of stress, I had a patient who's a 60-year-old engineer. He has 2 kids, both who are home safe with him. He's working, his wife is working from home, so financially they're okay. And as we started talking about it, he started to sob uncontrollably just from the stress. And it caught me completely off guard. But the emotional impact of this is huge. And the amount of PTSD we're likely to see coming out of it is going to be huge. Even though we know you can't spread this virus merely by walking by someone, that's not what the perception is. People feel if you're not 6 feet away, you're a walking petri dish to them. So think about what it's going to be like re-socializing, not just for you, but for your patients who are going to start coming out, including office, and be sensitive to that issue so that you're not only providing optimal care, but you're also providing it in an optimally safe environment and being sensitive to how patients are going to perceive things. And maybe now that if you're not seeing as many patients, take a few minutes and ask them how they're doing. Talk to them about what they're feeling through this, how they're holding up, what challenges they're facing. Make those connections because people need that. We all need that, especially for those of us who've been isolated for so long, that human connection is important. One of the things I had to do is that, you know, I worked with a colleague once who said, you know, I found out if I shake the patient's hand, it changes the mood of the encounter. And I said, well, I agree, but I hug half of my patients. Well, that now became verboten. You can't do that. So what I had to physically do, and some of you may face this as well, is when I got to the doorway, I had to physically stop, make eye connection with the patient and say hello, and then proceed into the exam room to stop me from physically engaging in any way. Well, now it's gotten comfortable. Nobody's expecting a hug or a handshake anymore, and I can walk straight in and sit down in the chair and start talking to them. But that may feel a little bit awkward for you at first, so you have to come up with a way that'll get you to modify the way you've behaved before compared to the way you do now. So with that, I'd like to, if we can open it to some questions, take advantage of the time we have left before we wrap up.
Yeah, you're right. I mean, you bring up some really great points. I think this is almost a new way of life for how we interact with people in general. We all have to think about that. So how, you know, getting your patients back into your office, how are you encouraging them to come back in? What's the communication means that you're using?
Well, what we've done is we've had a lot of people calling, and many are still asking us if we're open. So we're still getting a lot of calls, and our schedule is filling up just from that. But we're also sending out, we're starting by doing recall notices to all the people that may have been due for exams in the last couple of months to, to let them know that if they are due for exam, that we are available to do that and see. Some of them may call back and say, yeah, I'd like to, but I'm not ready yet. I had a patient who was developing a PSC, a secondary cataract. And I said, if you want to come in, if you're really struggling with it, we can take a look and see if it's at a point maybe when you need a YAG. And she said, you know, I'm going to do that. Let me give you a call in about 2 months. I thought she might come in the next week or two, but she really feels she needs some time. So maybe over the summer, I'll come in and we'll do that, even though she's struggling now. So there'll be those that'll put it off, and that's fine, as long as you're getting them on the schedule. But I think the best place to start is with your own recall schedule. You can do that by sending out a blast email letting everyone know you're available. You can target those that are due, and you can make phone calls and call those patients that are due, let them know that you're available for appointments, give them a little bit of background about what you're doing to social distance and the way you're scheduling to make it a safe environment for them, and see if you can get them on the books.
Yeah, great tips. A few questions about going back to this insertion and removal of contact lenses. So what do you do for these first-time patients that can't insert or remove their lenses even after watching a video? You know, do we need a new best practice with this?
And maybe it'll be the person who asks that question that'll come out with the new best practice, because it's a work in progress. I think that, as I mentioned before, there can still be a face-to-face training that could occur with additional precautions, whether it's a face shield in addition to mask, whether it's a physical barrier like a plexiglass shield. So I think it still opens up the opportunity, once your practices are open, to see patients for more routine care, to allow them to come in. But what we've done, if a patient's coming in for training, we're allocating an entire exam slot for them, where we're not bringing in other patients at the same time. So whereas I might see one or two other patients while that patient's going through the training, now we have it set up where that might be the only patient who's in the office during that time period. So some of it's going to be a scheduling template that's going to allow that. But I mean, ultimately, people are going to need to come back into your office. There are only so many things we can do remotely and through telemedicine or other types of communication. We need that face-to-face time with patients, and we'll just have to find ways to make it as safe as possible.
Yeah, that is true. How do you deal with walk-ins if a scheduled appointment is running late?
Well, that's what the challenge is. If a scheduled patient is running late, and this is something we're still working on, but we have enough time between patients that we can talk about that, or we can say, you know, if they call us and say, I'm running behind, about maybe rescheduling perhaps another time that day. I'm used to being booked out 4 to 6 weeks in advance, and now sometimes my schedule is 4 to 6 hours in advance. It changes day to day, so that we may be able to say, we need to look at another time. Can we have you come in maybe after lunch or something, or that we see what the schedule looks like of how we may be able to separate out the patient. So it's one of those that or maybe we have to schedule it for another day. But the way we try to prevent that is, when scheduling the appointment, we're letting patients know this is really important that you're on time. We have their arrival time scheduled 15 minutes before their appointment time, but it's critical to keep you safe, as well as our staff and other patients come in, that you are on time. If for any reason that's going to be a challenge for you, let's reschedule a more convenient time. Which reminds me of another thing. If you haven't made changes on your on hold message, this is an opportunity to do that and change the message that can include things about what you're doing about this, and also things like, you know, we're scheduling differently and spacing more, putting more time between patients, so there's less direct interaction. And you can even say, so we're running on time, and we ask that you do as well, at a courtesy to everyone else that may come into our office. So use all those resources, but the best way to prevent it is to be proactive and let people know of how critical it is in advance.
Yeah, a couple of questions about staff. So how are staff handling contact lens trials, et cetera? And how are you retraining your staff on these new procedures?
Well, in our case, because we haven't been closed, it's been more of us all learning together. But you should allow time for retraining as things come in. So if, for example, you come up with a plan, maybe you can email that plan to your staff members, and you can have maybe do a Zoom meeting of your own or some sort of meeting, so that you can go over those things now, get their feedback now, so they start to become aware of what changes are going to occur. And once you have a consensus on it and you set it as a in pencil policy, because we recognize that can change on a moment's notice, then when they come back to the office, allow time for them to be retrained in that. What we've tried to do when it comes to contact lenses, wherever possible, is to ship directly to a patient. It might even mean mailing diagnostic lenses to a patient as well. Just anything that can help with that. And when they come in, sometimes we can put them in an envelope and tape them outside the front door with their name on it, and they can pick it up that way. So there are ways to be able to decrease the traffic in the office with that as well.
Great. One last question before we move on. This is maybe, again, just a question about, and different offices may have different protocols, but what if a patient comes in and they said that they were positive 4 weeks ago? Would you let them in? How do you ensure the safety of your staff and doctors?
Well, it's a really good question, and I don't have a clear answer as to where we're going to have that cutoff, whether 4 weeks puts them in a place that they're safe, or whether we're going to look for more time. You know, I think that in any opportunity you have, is if you can err on the side of caution. So if someone calls, unless they have an urgent situation, and you make note of that, that you wind up, if you say, well, can we schedule you out in a few more weeks? Will that be convenient for you? To try to delay that wherever that opportunity might be. But there's no, at this point, again, remember, it's that blank slate. We have no clear standard of care at this point. So it's one of those that you're just gonna have to come up with what you feel comfortable doing, and then what you start hearing colleagues doing until we have a standard of care.
Yeah, that's great. It's a challenge right now. So let's move on to our next topic here.
Yeah, so we just have a few minutes left, but I want to just give some points just for you to keep in mind. One is, please stay aware of the fact that it's a very fluid situation. As I just said, there's no standard of care. So be creative and be open to ideas, and recognize that it's constantly going to change, and be prepared for that change and be willing to make those changes. Start by looking step by step at your office with fresh eyes, whether that's your eyes, your staff's eyes, a family member, a friend, anyone that can look at it and point out, just the same as when you try to childproof a home. You want to look at all of where those potential obstacles may be and come up with a way to look at that with fresh eyes. I think it's more important than just communicate what you're doing is educate. The distinction is just telling them what you're doing rather than showing them how the things you're doing are protecting them or are in their best interest. And the last thing I want to do, and hopefully we might have time for a couple of questions, I know we're close to the time limit, is on a positive note, please take a moment to marvel at the human spirit. This has been unbelievable. Think back to 2 months ago. We've been faced with an unprecedented crisis, and we've had very little time between opportunity to assess the situation, plan the situation, and then implement those plans. And look where we are now. Look how many things are in place when you go to stores, of the policies that are in place. So I would implore you to, one, be open, be patient, be flexible in what you're thinking, be bold, be transparent with your staff, with your patients. And to those who are just opening back up or are waiting to open up, is be prepared. Since 2/3 of the people listening in have not yet opened up, you have that time now to do that. Be aggressive with that time right now. And the last thing is, be optimistic. You know, through frightening times comes opportunities for innovation, ingenuity, and a chance to reinvent yourselves. So I'm looking and say, how can I reinvent myself? How can I be a better version of me and a better practitioner and a better person coming out of this than I am right now? So I would ask you, make the choice to not only be a source of outstanding care, but also as a source of comfort and of human care to your patients and to your staff.
Well, thank you for that uplifting message, Dr. Cohen, and thank you to the audience for all of your thoughtful questions. We will continue to listen to your feedback so that we can provide you with helpful events like this. And if you were part of our last audience, you helped choose tonight's topic. Our next interactive virtual experience like this one will be taking place next Wednesday on May 20th. So if you go to the chat, you will see a link to register. Dr. Heidi Pham will be our next speaker, and she'll explore tips and tricks from her experience reopening during COVID-19. We hope that you will continue to shape the future of the IVX series with us. So please take a moment to answer one last poll question, where you can share what topic would be most valuable for our next event and what time works best for you. Your voice is really important to us, and we want to stay connected with you. We will continue to broadcast these national events, but please reach out to your local rep, because we're also holding smaller regional roundtable discussions where you can speak directly to each other on what matters most to you. So I would like to thank Dr. Cohen for his wonderful insights today. His cleverness and ingenuity never cease to amaze us. Have a great rest of your day and be well.